This video is for educational purposes and demonstrates a standard of work on our labor and delivery unit during a CAT team. The scenarios are representative and may not reflect exact real-life situations. Actual responses may vary based on patients' needs, team dynamics, and available resources. Nurses should rely on their clinical judgment, training, and collaboration with the care team to ensure safe and effective care.
Hey Jordan, it's me. Hey. So baby's not liking this position, so let's try to turn to the other side and see if the heart rate will come up, okay? And move this. Okay. Get baby on better. Right now, let's try to turn to the other side. Yeah, he's still not making this. So let's go to this other side again. I'm gonna actually call for some extra help, okay?
Okay.
Call LND Resource Nurse 1.
Hi, Sadie.
Hey, Carolyn, I'm having some D cells in 4. Can you come help me?
Yes, of course, I'll be right there.
Thanks. There you go.
Hi, Jordan. This is Carolina.
Hi. So I've changed her positions a few times. I've stopped the pit, but baby's still having some significant variables.
Okay, so I'm just gonna help over here.
Okay.
Gonna put your head down,
Alright.
and we're gonna change your position again. Okay.
Okay.
Just let me call Dr. Vandermoorter. Hold here, Vandermoorter. Okay, so the pitocin is off,
Here, Van
and we're
Remorter.
giving IV bolus.
Yes.
Okay, and then she has a 3-weight on.
Yes.
Okay, great.
3-way is on. Okay.
Carolina?
Hey, Dr. Vandermoorter, we are in room 4 for D cells. Can you come to the room?
Sure, I'll be right there.
Thank you. Okay. Let me call for some term just in case
Yeah.
we need it.
Hi, it's Dr. Van Morter. Hey, Dr. V. So we've been having some D cells for the past
Hey,
5
Samantha, can you need to
contractions.
bring me some turf to room 4?
Yes,
I've stopped the pit and I've started an
Thank you.
IV fluid bolus.
Okay, and you guys have tried position changes
Yes.
and everything like that? Okay. And I just heard Carolina calling for some terbutaline, which I think is a good idea, so when the terbutaline comes in, we can give it.
So she's been having some variable D cells down into the 70s for the past 5 contractions.
Okay.
We've tried different positions. I've stopped her pit and I started a fluid bolus.
Okay, great. Hey Jordan, how are you feeling?
Okay.
Okay, it sounds like the baby's having some dips in the heart rate with the contractions, which is pretty common, but we do want to make sure that we get them to go away. And we're going to probably give you a medication called terbutaline that goes under the skin. It helps to decrease how strong and how frequent the contractions are. Okay, great.
Yeah.
Okay, good.
Dr. Van Morter, I have terbutaline. Would you like me to give it?
Yes, please, let's give it.
Okay.
Okay, well, I think after you get the terbutaline, it might be a good time to do an exam to see how dilated you are, because I think we have to question a little bit. Sometimes when you're more dilated, that will also cause some drops in the heart rate. Any clinical changes since, like any bleeding?
No bleeding.
Okay, any rupture of membranes recently?
No, she's been ruptured for 18 hours with
Okay.
neck.
Okay. Okay.
One of the resource nurses.
Hi.
I'm gonna give you a shot and you'd like to hopefully slow down.
Okay.
We're here all here to help.
Thank you.
All right, Jordan, do you feel like you're ready for an exam to see
Yeah.
how dilated you are?
Yeah.
Okay, all right. Thank you.
Okay.
And we'll see.
All right.
I'm just waiting to see
Turbs
if
in.
it blocks out the contractions a little bit.
All right, let me help.
So Jordan, I did the exam and you're about the same, like 4 centimeters.
Okay.
So it doesn't seem like the reason for the variables for the decelerations is because the head's coming down a lot yet.
So I noticed the heart rate's been down for a couple minutes now in the 70s.
Okay,
Going
so
in here.
I think the terbutaline didn't kind of get rid of the contractions enough, and baby's feeling kind of stressed right now. So I think that we should go back to the operating room.
Okay.
There's a chance that we would need to do a C-section, like we talked about before. But we'll check what the heart rate is when we get back there. So the whole team's
Okay.
gonna come in.
Okay.
We should call a CAT team.
Okay, I'll call a CAT team.
Surgery. Have you had surgery on your abdomen before?
No.
Okay, so this will be really fast.
Georgia broadcast CAT team.
Low. Risk of bleeding, possibly blood transfusion, very unlikely. There's a small risk of infection.
CAT team, LD4 to OR.
There's a risk of
CAT
infection.
team, LD4 to OR.
There's a small chance
CAT
of
team,
infection.
LD4 to OR.
There's a risk of injury to organs around the uterus, so things like the bowel, the bladder, nerve vessels, the uterus.
Lots of people are gonna come in the room. We're gonna be moving really quickly now, okay?
looks like
You're in good hands.
Plugged. Thank you.
All right, I think we're ready to
We're
go.
ready to go. Careful of your step.
Pass, okay?
And moving the cords.
Thank you.
There we go.
All right. Okay.
Hi guys, my name's Chris. I'm the anesthesiologist. Dr. Vandermoor, can
Yeah.
you tell me the S-bar, please?
Yeah, so this is Jordan's just term. She's having a bradycardia, moving to the OR. She has an epidural that has been working for her.
So my name's Chris. We're going to take really good care of you. I'm going to give you some stronger medication through your epidural here. And we're going to take go in there and get you all cleaned up. And we're going to start doing some tests to make sure this epidural is working like we expected.
C or C. In time, 9:46.
Can you keep the noise level down, please? I'll take the bed out. Thank you. Okay, so do you want to count?
Okay, let's count.
Male, male.
1, 2, 3, 4.
Call
Kelly, 1, 2.
What are we seeing on the monitor? Looks like it's smartphone to the side, going to the 70s. Okay, so we're gonna need to go quickly, guys.
Anything other than pressure?
No.
We are good to prep.
Okay, we're not gonna prep because the heart rate is still down, so let's just get the bogey pad on and, okay, all right, I'm gonna go scrub. How would you like your settings to be? 40-40. Okay, great. All right. Action is 5. Great. Okay, ready to start.
Take a moment to look at the CAT team roles when in the OR. Ideally, each role remains in their designated area while prepping the patient for the C-section. Notice that the primary nurse is positioned toward the foot of the bed. This allows the primary nurse to write on the whiteboard, use the CAT team clipboard, S-bar to the NICU team, and count with the OB techs. The resource nurse on the patient's right will be able to assist with left tilt if requested, apply the Bovie pad, apply SCDs, and connect the suction. The left resource nurse will assess the fetal heart tones, start an IV, assist anesthesia, perform abdominal prep if needed, secure their leg strap, and most importantly, communicate with the patient. The charge nurse will assist with the removal of the labor bed and provide needs outside of the room, like updating the family, designating tasks, communicating with blood bank, X-ray, and IR as needed. We hope that staying within these designated areas will help promote efficient care and ensure the safety of our patients.
Can we do a timeout? Yes. Jordan, we're going to be doing a timeout to make sure everyone's on the same page for the surgery. Everyone's going to just be listening now. Okay. So this is Jordan Doe.
Yes.
Okay. And the ALS team is here?
NICU team is here.
Okay, we're ready to start.
Jordan, where's your beautiful baby?
Would you like to do a sign out?
Yeah. This is Jordan Doe, paid 4,100 on the boards, we'll say 1,000. Okay, all right, thanks. Sadie, I'm just thinking that after the case we should have a debrief just to go over things into the CAT team.
Okay.
So let's get the team together and talk about it afterwards.
In some cases, a patient may not have an epidural in place during a CAT team. If there isn't enough time to safely administer a spinal anesthetic, the anesthesia team will proceed with general anesthesia.
All right, testing. Can you feel anything, Jordan?
Yes.
Okay, she's not comfortable.
Yeah, we're going to go ahead and do this under general. I'm going to start pre-oxygenating. Dr. Jesus, please drop some medication.
Okay, you let me know as soon as you're ready.
We're going to give you some oxygen here, and we're going to start dropping some medications, all right? All right, you let me know when we're ready to induce.
Okay, we're ready for you to go ahead and do
Great,
something.
we are inducing. Okay, inducing. All right, so please. Airway is in, it's secured, you can go.
In conclusion, this video serves as a valuable learning tool to illustrate the coordinated efforts and best practices of our labor and delivery team during a CAT team response. While the scenarios presented are educational and not exact replications of every clinical situation, they highlight the importance of critical thinking, teamwork, and adaptability. Above all, patient safety and quality care depend on nurses using sound clinical judgment, following their training, and working collaboratively with the entire care team.